What has ASEAN done concretely vis-a-vis this crisis, and what were the lessons of the past that it has actually implemented?
I have, or we, the group, has received some challenging questions, in terms of what were the lessons learned from the previous public health emergencies and pandemics. Mind you, the lessons from the ASEAN health sector context that is being applied right now at the regional level and also at the and translated at the national level are based on lessons learned from the SARS pandemic, the H1N1, the Ebola, MERS-CoV, as well as the Zika virus. No, so in as early as the 2002-2003 scare of SARS, and also the conduct of tabletop exercises and simulation exercises related to SARS, have also shown that much of the coordination of relevant sectors in responding to any form of epidemic, not only responding to but being prepared and able to respond to any form of outbreaks at the national regional level, is really one thing. It's lacking in terms of coordination at national and regional levels. So that's the reason why much of the international health regulation capacity building initiatives led by WHO to each of the ASEAN member states and other countries were likewise used as a reference in improving national capacities to responding to emerging infectious diseases. And also the lessons learned from the previous diseases at the ASEAN health sector level were likewise utilized in developing certain preparedness and response mechanisms in the aspects of prevention, detection, and response to any form of pandemic. Concretely, this was translated into more coordinated mechanisms and platforms by establishing it through the support of other partners. It's not only ASEAN member states dealing with its own problem, but it's also cooperating at the bilateral or regional level with other countries. That's the reason why we have this ASEAN Emergency Operations Center network. This is a network of emergency operations center from each of the countries in ASEAN member states that have already been established. And they form a network so that there could be an appropriate exchanges of information, critical information, as well as technical updates and real-time exchanges of information. If I may also share that during the COVID-19 outbreaks, when there was this cluster of unknown pneumonia cases was being monitored and observed in China, the kind of coordination and the kind of trust that was built between ASEAN Secretariat, ASEAN Health Sector, as well as China counterparts, through this particular relationship, talking about being personal as well as being and being engaging, we received the initial reports of this cluster of cases as early as the first week of January. And when we received this report, this was immediately shared with the respective focal points dealing with international health regulation, focal points dealing with emergency operations center and as well as public health emergencies. So this sharing of information was made through the existing platforms and mechanisms, which were not really existent during the SARS phase or the post-pandemic, pre-pandemic phase of SARS. And based on that particular ease of sharing information, we were able to test the existing mechanisms. And of course, as I mentioned earlier, in terms of lessons learned, there is much to do in terms of organizing a regional response, no, in terms of involving non-health sectors. You might say within the health sector of ASEAN, existing mechanisms are being undertaken already. We have this network of disease surveillance, network of laboratory people, network of focal persons concerned with public health emergencies, network of people, network of officials from each of the member states dealing with risk assessments and also monitoring the progress of the COVID-19 trajectory by utilizing artificial intelligence and other digital technology platforms. So these networks are not existing simply because they are just network and just to attend meetings, but definitely they are coordinating at the regional level, exchanging data, and this data are sometimes sensitive, no, in terms of patients coming from one country to another, being COVID-19 reactive in one country, traveling from another country. So these are being shared through real time. In fact, during this conversation, I am reading through exchanges with regard to some of the passengers that arrive in one country being COVID-19 positive, and they have history of travel from another country. So these are being shared real time. So this was not existent in before 2010. So what I'm trying to say is there were definitely lessons learned from the past pandemics. There were during the SARS event, we lacked regional coordination. We lack a systematic way of communicating technical and sensitive information. We lack, you might say, transparency in sharing data. But now, although there is much to be desired in the current mechanisms, there are already mechanisms that would facilitate regional exchanges, not only of information, but also assistance, technical assistance, as well as medical supplies. And aside from that, based on the current experiences in COVID-19, which is basically new to everybody, new to each sector because of the scope and magnitude of the effect of COVID-19, as mentioned by my fellow colleagues, the region, ASEAN region, has done comparatively well with regard to other regions, simply because we most of the ASEAN member states were able to respond timely, in a timely manner, as well as adequately in terms of being prepared to contain the outbreak of COVID-19. So the things that I have mentioned in my presentation earlier in terms of sharing situation updates, forward-looking in establishing an ASEAN Center for Emerging Diseases, having a risk communication report, risk assessment report, regularly shared to other focal points. This have been well established based on past lessons or past experiences. But as I mentioned earlier, in terms of lessons learned, we do need to target, in terms of the regional perspective, a more concrete operational framework of coordination and cooperation that would involve all relevant sectors in preparedness and response to COVID-19 or any forms of pandemic. And mind you, there would be upcoming pandemics that would be coming aside from COVID-19. Over to you, Professor Johan, and to
Dr. Fernando. You basically are pointing out to us that ASEAN is relevant. For the reason that if it was not there, many of these things would not be done. It's a very simple, answer to that question. And you have pointed out to the very specific cases of where this cooperation has taken place, because there's much more that's needed to be done in the future. But clearly, if the mechanisms were not there, or if ASEAN were not there, then these mechanisms would not exist. Thank you very much for the explanation. We actually have used up our time, but I would like to sort of, let the other two panelists have 1 minute each, perhaps, to sum up your thoughts or to respond to that final question. Fitina?
Okay, just in 1 minute. Look, I think it's a very good question. I sense the exasperation and concern behind the question. I share it. And the question has to do with what has ASEAN really done for its peoples, the different peoples and different societies. And it's a valid question. It's a perennial, penultimate question. And the way I answer is like this. I mean, look, we don't need to talk about relevance. ASEAN is relevant. If you talk about relevance, it means it may not be relevant. If you keep questioning yourself, this is a big region. I mean, it's got 655, 660 million people, good-sized GDP. It's come a long way, 53 years. So the relevance, the resilience, there's no doubt. But the question is valid because we have a lot of the bureaucracy. It's almost talking in a parallel universe. The way that the bureaucracy would respond with another kind of acronym or a mechanism or another centers being set up. But in fact, the real peoples of ASEAN are not being addressed. The peoples of ASEAN, they live in borders. I mean, they're behind borders, and borders to ASEAN are paramount. And this is the way we have to recognize first and foremost. But beyond borders, I think that you can see differences between ASEAN states, ASEAN governments, and ASEAN societies. I use one case of the Milk Tea Alliance. I don't know if you followed it a little bit. There's a acrimonious debate, discourse between Thailand, Hong Kong, Taiwan, and then Philippines, Indonesia all kind of jumped in. What we saw then was a kind of a China versus East Asia kind of debate about government regimes and so on. But what we saw then is that societies and governments can be very different. So, for example, in the Philippines, government seems to be very much in favor of China or answerable or cordial. But Filipino society may take a different view. We've seen some skepticism, some reservations, maybe even the opposition. In Thailand, similar. So I think the way I would answer this question, which is it really is the ultimate question, is really asking about its peoples. So if we promote more people, not just people-to-people contacts, but these societies to have kind of common basis, bearing in mind that governments can have very different views, very different positions, but the ASEAN societies are more in line, are more aligned than their governments. And in the longer term, this is how you really can focus and make ASEAN people-centered. But it will take a little bit of time. It's a good question, and it's something that I think the bureaucracy will not be able to address. But in the longer term, maybe this is the ultimate locomotion, the ultimate momentum, and rationale behind how and why ASEAN can move forward beyond 53 years. Dr. Johan, thank you.
Thank you very much, Benny, for a very interesting question. I also take your point that ASEAN is to benefit the people. In the economics pillar, the people in the economics pillar are the business community. So if what is done in the economics pillar promotes businesses in the region and businesses in the region to do business with each other, then it is assisting the people in ASEAN by creating employment. So that's how I look at it as an economist. Mm-hmm. Whether it translates to that and how long it takes to achieve, for example, as in the case of RCEP, can be many years, but we will eventually get there, as in the ASEAN Economic Community that we are building step by step. I don't believe we haven't done anything. I think we have done something in ASEAN. It may not be at the level we aspire, but that doesn't mean we haven't done anything. That's the way I look at it. So to me, ASEAN remains relevant.
Well, we're past our time, which is it's a credit to us that we are all still here listening after 2 hours, and thank you very much for staying the course. So I don't think I'll summarize, or I can summarize the discussion. All I can say is I think we've had a very, very informative, a very rich discussion, and I think we've heard quite important insights as to sort of the direction we want ASEAN to move in terms of the crisis that it has faced with the pandemic. So the pandemic itself, as I see it, is a catalyst for ASEAN to become more robust, for ASEAN to become a better regional organization. And I think all three speakers have spoken to that issue. Is talked about some of the weaknesses, implied weaknesses of ASEAN. And I think this pandemic certainly is not over, and much more needs to be done. Is definitely a kind of platform, a kind of a catalyst for it to move forward. So now, I think I'll have to basically end the webinar here. And I'd like to thank the three panelists for having contributed to this. Dr. Fernando, for your views on the health situation and how ASEAN has been collaborating on this. Dr. Chetinan, for your insights into the politics and security issues. Professor Tam, for your assessment of the economic issues and where we should be heading in terms of the future. And of course, to the audience, thank you very much for staying on and listening to all the speakers till 4:06, which is past our 2 hours. So thank you very much. Goodbye. We hope to see you again in the next webinar.